want to welcome everyone to our Lunch and Learn. We're going to give this just a few more seconds for people to join, and we are going to get started. Okay, you should be able to see my screen today. I'll just turn my webcam on. Thank you so much for joining us and taking your lunch break to learn a little more about after-hours calls and hopefully what you can do even during business hours to help with managing those calls. My name is Rebecca Shade, and I have been with RemedyConnect about 16 years working in the pediatric space. I really love working with practices and seeing how we can help with workflow with the practices and find some awesome solutions. We also have Justin Medina on this call today. He's the Remedy On Call Support Manager. He has about, I want to say 20 plus years with call center experience. He is going to be answering questions at the end for us. So as questions come up, please put them into the go-to panel, and we will be going over those at the end. So really happy to have Justin with us as we walk through the call center. He takes care of everything after hours. We say that, but that truly is 24/7. If you have calls that are just an overload during the day, we can also take those and help you with that. And so he's there to give just a lot of support and great ideas. What we're going to learn today, we're going to go over a lot of people when they think answering service, they only think after hours or during lunchtime, but it really encompasses any time a call comes into your practice. And we want to make sure what is happening to those calls, whether that is a Monday morning where you're having lots of extra calls, people are not getting answered, they're on hold for a really long time. What are some solutions there? We're going to examine who's actually answering your phones, whether that is in the office or outside the office. That is a first impression when it comes down to who is picking up those calls. We're also going to look at those missed calls. There are revenue opportunities that come to us. And as pediatricians, I know that they are really famous for giving away free advice all the time. And so we just want to look at what that can look like with all these extra calls coming through. And then we are pediatric specific in what we do with our call service, but there are things that we can do to help reduce the stress and hopefully build confidence in your families when they reach out. And then we're also going to look, there are times when there are non-urgent calls coming through, and we want to see how can we reduce that call volume and better direct our parents and patients to the right place to go so that certain calls don't have to come through when they can find those answers someplace else. So Remedy On Call has been around for a little over 18 years now. It is part of RemedyConnect, the answering service solution, and we have a pretty fantastic platform. We actually built the software ourselves. We wrote it, so it's customizable. It is proprietary. I love that we wrote it because there are times when you just have to make changes to fit the environment and how pediatrics is growing over the years, and this allows us to do that. Right now we're serving about 100 practices across the country, and all of our agents are US-based. I say that because when you're reaching out to other answering services, oftentimes you are being routed through the Philippines, Mexico, other countries. And so we are really proud and happy to be able to offer that our agents are based here in the US to help you. We have some great solutions. We are integrated with our telehealth through the answering service. You do not have to use that solution, but it's really easy if you want to move over to also adding that solution. We're going to be talking about telehealth next Wednesday with Claire Huber-Naven. She's going to really open that up and show us some awesome things. We also have HIPAA secure messaging. I think that's very key that we are HIPAA compliant. We have a secure mobile app with multi-factor authentication. That means you can get into the app with your facial recognition, a fingerprint, a PIN, but it is safe. No PHI is stored on your phone, and that is really key just to protect your patients right now. Lots of customization you can see here listed, and we're going to walk through some of that here as we look at some different screens. But we're going to ask a question just to get us started here. If you haven't done this, I encourage it, but have you ever called your practice after hours? Sorry, I don't think you guys can see this yet. You put that up. Have you ever called your practice after hours to see how your calls are handled, that you are a secret shopper within your own practice? I'll give you a moment to answer. Excited to see what you guys think of that. Getting lots of answers coming through. We'll give you guys about 30 more seconds here. And this could be during lunchtime, during regular business hours even, to see how those calls are routed, or after hours when the phones are closed. It's good to test those phone lines. Okay. I'm going to close this and let's look at the results here. This is telling it's half and half. So half of you have secret shopped, the other half haven't. Again, highly recommend that you do this. It is so important to know that is the first impression of your practice. When someone calls, whether it's a new patient calling for the very first time or a parent wanting to get additional information, or someone who's a regular client and they've been with you for years, who answers the phones is important. So we want to look at your practice voice, and that is really who is answering the phone. It's also your website presence. Your voice can be in many avenues, but today we're really deep diving into who's answering those phones. So within the office, oftentimes those are some of the lower paid employees that you have answering the phones, but it's really one of the most important jobs. How are they responding? Is it clipped and really quick? Are they having a really happy voice, smiling when they're answering the phone? Have you taken time to actually train? This is a great way to answer the phone. Even shadowing, having some of those employees listen in as some of your best employees answer to see how they direct that conversation, super important. Even before they get to that live voice and listening to your message. So this, sometimes it's been years since some of my providers have actually stopped and re-listened to their own message. So I'm just going to touch on this really quickly. We are creatures of habit, and when we are hearing a message on the other side and we just want to get past that recording and get to a live person, what do you push? Most people will push 1, 9, or 0. They just start pushing those buttons and they're hoping to get through and bypass whatever the rest of the message is to get to a live person. So here I'm going to recommend when you're transferring calls, whether it's to an answering service or to other things in the office, try not to use 1, 9, or 0 so that they have to listen to your message. You want to greet them, thank you for calling Pikes Peak Pediatrics. That's my pretend practice. We always say, if it's an emergency, please hang up and dial 911, and then you can go into the rest of your message. It's really good to direct them to your website because you're wanting to direct them to quick information that is easily accessible to them, and often frequently asked questions are going to be there. In that message, you can even list out what they can find on your website. If you're calling for medicine dosages or an RX refill, tell them what to do. So whatever your practice protocol is, you're kind of laying that out in the message, but it should be a fairly quick message as well. And give the website URL. You don't have to say www, you would just say pikespeakpediatrics.com, because as they put that in the browser, it will pull up. So again, just listening to what your staff are saying on their side of that. Also, now after hours, and that can be any time your phones are turned to a third-party company to take those calls. So lunchtime and when you're closed are the most often, but there's also the option if you're having an overflow. So maybe you have 5, 6, 7 lines that are live coming into the office, but when all of those lines are in use, what happens to the rest of those calls coming in? Do they get dropped? Do they get a busy signal? And another option you can have is you can send them to the answering service. So there is a live agent that is picking up that call. Most of our calls are answered in about 50 seconds or less. So we're able to take that message, and then the parent or patient doesn't have that frustration that they're on hold or waiting for, some practices tell me 15, 20 minutes, especially during busy times, because they're just wanting to get a message through to the office. Also walking through that after hours message, and most phone companies can set it up so you have a message during business hours, a separate message maybe at lunch and after hours, and you can change that around. So if your protocol is we do not take RX refills, after hours, we're not going to send out medical records, immunization requests, or appointments after hours, then state that before it's ever sent to the answering service. Call back during normal business hours, or please go to the patient portal, log in, and request it there. Again, direct them exactly how you want them to act for each scenario. And the last one here is the practice voice is the triage you choose to use. Remedy on Call works with triage companies across the country, lots of children's hospitals, also other companies. If you need recommendations, let us know. Fantastic triage companies. Some of them are with compact states. So even though they may be located in Texas or Colorado or somewhere, they can actually cover 36, 37 states to be able to take calls there. Some states are a little trickier, like California, who the requirements there are different, but at least you can get the information needed. Sometimes with triage, you can actually use your own staff. So you may pay a nurse within the practice to take calls during certain hours, and it's very easy to transfer those messages on to a clinician in the practice if it's something they can't answer. Let's take another question really quick. So do you know how many calls are going unanswered during the day or after hours? Do you know where to find that information? And are you looking at that? We'll take a moment to answer. About half of you have answered. I'm going to wait just a few more seconds. Okay, let's share the answers here. So 20% of you do know. You know where to look to find that information. 80% you do not. I would also really encourage you to look at this information. If you're missing a bunch of calls, that's revenue that you're missing when those calls are coming through. It might be frustrated families, and it might even be people deciding to leave the practice over just not being able to get their calls answered. I just recently met with a practice, and that was a huge frustration. When we looked at their Google reviews, the last 5 reviews that had come through that were negative were all on this point right here. They would call, their calls weren't answered, they were on hold a very long time, and it created a great amount of frustration in those families. So here, when you're looking at that, usually when you work with your phone company, it will tell you the days and times as well. And you may say, like most practices, it is Monday morning. Those kiddos have gotten sick over the weekend, and there is a rush of calls for the first few hours on Monday, and maybe you need greater assistance and be able to send those overflow calls on to an answering service. We also have a digital solution that we can add a button to your website, and instead in your message, you could just direct the parents right to your website to click on that button, and they can send the message directly through that way. It could be faxed to your office. It can also go through the secure mobile app any way you want, but then the people in the front office can grab those messages when things slow down a little bit. So with our solution, because we wrote it, I think we've set it up in a very end user way that's just very easy to use. So when those calls are coming in, we have a dashboard to help the providers and the practice go in and see what messages have come in. So on the left, you're going to see that as a desktop dashboard, and you can also reach all of this information by going to your mobile phone, and it shows up and displays a little bit differently. With the information that we're going to see within each of the different sections here, we just tried to pick the most used items that providers go to make this really easy to walk through. I'm going to pull up a live site. So this is what we're looking at here as well. But when I'm here and clicking in, I just wanted to point out a couple of really easy things. Setting up a roster is very quick when we're doing this. Oh, I had it up too long. Sorry, it's going to make me re-log in here. 1 second. Now we'll look at this again. So here, as I go back into the roster, if I want to add days, I would just select the days that I want a provider to be on call. When I enter the roster, I can choose anyone to be on call and the time they're going to start. And then all I do is click update. You'll see immediately within the roster that person has been added. To delete someone from the roster, you would just click on the X and take them right off. So the roster does live in real time and make it very easy for your office to see what's going on and for you to make updates. You can also download the roster, put it in your lunch or break room if you want a physical copy for everyone to see who's on call. You also have the ability to add notes here. Those are internal notes for your practice, but if you want that on the rounding roster, you have that choice here as well. We also have different types of rosters. Because we are pediatric specific, we can do any medical specialty, but the majority of our practices are peds. If your practice rounds on newborns, we have a newborn rounding roster. So maybe one of your providers is doing on call and you have 2 providers that are rounding at hospitals. You can even select which hospitals those providers go to and receive newborns from. If you use a hospitalist, no worries. Usually those are called into us as an FYI. We'll still take that message and you'll have that in your call history so you can make sure that those newborns have been seen. Here on the dashboard, we try to make it very quick on getting to information without having to dive any deeper into this program. You can connect here, like if you have our telehealth, you can go right into it there. But the last 48 hours of messages will show up here. Same with our newborns last 48 hours. And whoever's on call 7 days into the future will show up on this page as well. Within our call history, we have some really awesome things that show up. So I'm just going to take you there. This is very unique how we've set this up. You can search. Some practices have, I like to call them frequent flyers. They call the practice all the time. You can look them up and see what you want to do with those patients and how you want to handle that. One way to recover some revenue for that with your frequent flyers is to make sure that in your after hours message that you have the ability that you can charge. And so when we're answering that call, we could say, if you would like to reach out to the on-call provider, there is a $15 fee, a $20 fee, whatever you want to charge. And then we ask, do you want us to continue with the call? It is all recorded. And if they say yes, then you are able to charge that fee. Some of our practices do it on a case-by-case basis so that it is said, if it is an emergent request, we're not going to charge you. If it is, how much Tylenol do I give my 8-year-old, and I could have found that on the website, then we may charge you for that call. So some options. A really unique thing that we offer, I actually don't know another answering service that does this right now, is you can listen to your messages through us. So we save the .wav files for about 30 days. What that does for you is if you ever want to listen to the message that came through, you can hear how our agents were treating your families or the hospital or lab that called in. That's important to know what is our voice towards your clients, and so you can see that or listen to that. You can download those and save them as well. Since we only save them 30 days, they'll start disappearing, but you can download and save any .wav files you want. Another option we have when you pull up a message is that you are able to send it on to anyone else in your practice. So especially if you have maybe a nurse taking call or a mid-level and you want to send it on to another clinician in the practice, all they have to do is click forward. They can choose any provider within the practice and type in their own message. The other provider will get the original message along with anything that has been written here. The other option you have is you can download all of these messages into a PDF and upload those into the EHR if you want to have a record of that encounter after hours as well. For all the messages that come through, it's really big on how a provider is going to be notified. And so with those notifications, we want to make sure that it is secure with anything that's coming through. So I'm going to hop back to a picture here. This was just showing how to forward the message, but over here, if you're on our secure mobile app, you have a few options. One is you can call the practice, whoever's on call for the practice can call a parent or patient back with one click, and it blocks your phone number. So you don't have to put in, different numbers to block the phone number. You just click the button. The other option, like I said, providers give away free info on a regular basis, but a lot of the messages that come through really could be a legitimate telehealth visit. And so with the click here, you can just schedule a telehealth visit. You can start it immediately, or you can schedule it into the future. Just a note here, the provider will have the secure mobile app downloaded. The parents and patients don't. They're going to get a web link. It takes them right to a website. It is still secure. They will register and log in, and then the provider will be notified that they're in the waiting room. So here, instead of giving away free advice, you can have a billable encounter. So we'll go more into that next week as well. Coming back to some information over here, I want to take you through notifications. So customizable notifications are very important. Each provider is unique in how they want to be notified. So here I'll just look at Minnie Mouse really quickly. We have 7 call types that we break our messages into. And so the ones, if you have a triage company that you're using, only patient to doctor messages should be going to triage. If triage is also your after hours answering service, they're getting 100% of your messages, and that can get very expensive. So this can save time by doing it this way. And then you can choose in 15-minute increments how you want to be notified for each call type. There are some very cool things we have set up back here. I won't go into all the details, but it is good to know that there's lots of options, also including how we message. So we do charge per minute for our answering service. So to put the power back in your hands here, you get to decide what questions we ask, what's required, and what will be sent out in the message. The more questions we ask, the longer the call. So to keep that call shorter, you can really decide what's important to your providers to have with that information before we move forward. It's a really, really great feature. I have another question I am going to launch here for you guys. This is my last polling question. Have any of your providers been wakened at 2 a.m. with an RX refill or medicine dosage question? It may sound silly, but you might be surprised at the answer here from other practices. We'll give you about 20 more seconds to fill this in. Okay, so here we are split down the middle for the second time, half yes, half no. Here, I hear a lot of yeses with this on my side, that a lot of providers are really getting some messages after hours that they shouldn't be. And I know that can be frustrating. They also have families, and they also love to have their sleep. And so whenever possible, we want to continue to direct people to good medical information. If it's emergent, absolutely that call should go through. If it's not emergent and it can be handled during normal business hours, to encourage the families to do that, or to self-serve on your website, as long as you have good medical content. We don't want to just send them to Google, but if they can go to your website to grab what you know is reputable content, that is preferable in what we look at. I'm going to scroll through a couple of these really fast because we've already looked at that. But one way this can help is on the screen. We do offer Remedy Messenger, and this is another way to reduce some of those phone calls that come in. One, you're sending them to your website. And so they're going to see, oh, there is a lot of good content that I can grab from here. And just having that bookmarked is really important. Also, you decide when the button shows up on your website for this option to be there, that they can just reach out online. The parent actually registers, that's free. And when they decide to put a message through for their child, it is about half the price, a little less than half the price. It works out for them to send it through themselves. So we want to encourage practices to lead patients that way, and for patients to be able to do that. It really reduces your non-urgent call volume that could be coming through, and you get to control when this shows up. Hopefully you guys have been putting a few questions in the box. That's just a very brief overview of what we answer, but we want to have time to answer questions you put through. So I'm going to bring Justin on board here, and we'll go through some of these questions. Let me pull these up. So the first one, Justin, can you contract for services that are only for after hours, like between 6 p.m. and 7 p.m. and not the entire 24-hour period? So I think they're asking here, can they just choose to use this for certain hours during the day? Justin, are you able to hear me?
Yes, Rebecca, thank you very much.
Lovely. Okay. Yeah.
Yes, the answer to the question is absolutely. We can work specifically within different time frames that you need us to answer for. Again, that might be only after hours. Maybe you want us to answer 24 hours a day. We can also provide rollover services for um, during your office hours when you get busy. So we are available to work with you in a form of partnership to answer your calls when needed.
Perfect. This is a great question. You um, cannot charge for Medicaid patients for after hours, absolutely. So when they're Medicaid, that's something like if they're doing the telehealth, we actually take away the option for payment if when we're asking for insurance, they say Medicaid, there's no option to make a payment during telehealth after that. And same with if they were Medicaid, we can add that in to the question there when the agents are talking, and they would not be charged because they can't be. That was a good question. Okay, next one for you, Justin. Is there a minimum monthly charge to use the answering service?
We do actually have a minimum monthly charge, but it's very reasonable. We do our smallest package is just $25 for 25 minutes.
And when you start with us, I want to point out for the first 3 months, we actually bill just actual usage. And that is to kind of determine what is that call volume coming into us. And then Justin works with the practice to decide on the best minute plan that will fit that practice. After 3 billing cycles, we have a really good idea of that call volume. Okay, next question. Can you arrange a repeating schedule such as Dr. X is on call every Monday for that call roster?
When you're entering the on-call roster, there is the ability to select all Mondays and then add that provider is on call for all Mondays. We are working on a feature in the future where you might be able to copy a schedule from month to month. That's currently not in place, but the ability to just say Dr. X is on call on every Monday can be completed in about 15 seconds.
The roster, we have heard such good feedback on how quick and easy the roster is. Okay, another question, lots of questions. How much notice do you need if we decide we need extra help taking calls during a workday?
We are available to help you 24 hours a day, 7 days a week. It is going to depend on your practice size as far as how much advance notice the call center is going to need. If you have a practice of 100 providers, obviously to get a sufficient staff on board is going to take us a little bit longer than if you're an office with only 2 providers where we're only expecting maybe 3 calls an hour. So it's really going to depend on the size of your practice. We usually ask for at least 24 hours notice, but we understand that things are going to happen, and we're going to work with you the best we can to bring our staff up to par in order to assist you in any sort of situation or emergency you might find yourself in.
That is awesome. Okay, here's one more. When a call comes in, how do the agents decide if it is an emergent message versus a routine message?
Our call center uses the Barton Schmidt triage as a guideline as far as how to do basic triaging on your particular messages. So again, depending on the type of situation, the agent is going to analyze that situation, refer to the web flow that we have available to them, and then make that decision at that point.
Yeah. And I want to say when we first started, we used to ask, is this urgent? And we stopped because we found 100% of the parents said it was urgent, whether it was Tylenol dosing or their kid had a concussion, it didn't matter. It was urgent. And so the agents really do listen, tone of voice, what's being said. And then we do have that list by Dr. Bart Schmidt, and we worked with Children's Hospital in Denver to really say these items are emergent. Like if there is a fever in a newborn under 6 weeks, we just mark it urgent. That shouldn't be. And that is the first word that goes out in the message. So whether triage is getting it or a provider, the first word they see is going to be urgent. Just one more note, we have worked with children's hospitals for quite a while. We have a fantastic relationship with Denver Children's, where Dr. Bart Schmidt has been for a very long time. But they trust us so much with our agents. We're electronically connected to their triage there. And if our agents mark it urgent, because of their trust in us and how we've trained the agents, it moves to the very top of the queue. So they do trust if we say that it truly needs to be answered in 2 minutes or less. And so they take that to heart when they're answering the triage messages for us. That was the last question I see on here. Anything else you want to mention, Justin, as you were listening in? I may have missed some really key items today.
I think you did a great job giving an overview of the service. So I don't really have much to add.
No, that's awesome. If anyone has additional information, please let us know. We have links and resources. Hopefully that slide is showing for you. So we do have a one sheet that talks a little bit more about what we just covered. You'll also have access to the other lunch and learns so that you can see what we've gone over. If you want to watch any of those videos, they're each about 30 minutes that you can grab hold of. Truly encourage you, if you can, to join us next week for telehealth. It does go hand in hand, not only with the answering service, but works seamlessly with our websites as well. We look forward to seeing you again next week. And again, thank you for taking time out of your schedule to be with us. We know everyone is super busy, and it means a lot that you were able to sit here with us today. We appreciate it. There will be a drawing, so we'll get back with you soon on who is a winner from that drawing. Thank you and have a great day.